Welcome to Roadmap to Residency, Evidence-Based Application. This video is about neuropathology. Again, everything that we are going to discuss in this video is discussed in detail in the neurology module. You can go and refer to those modules after this video. So a 35-year-old woman presents to her neurologist with complaints of visual disturbances, weakness in her legs, and difficulty with coordination. She reports a history of intermittent symptoms over the past few years, including episodes of numbness and tingling in her extremities. Physical examination reveals nystagmus, hyperreflexia, and bilateral extensor plantar surfaces responses. Sorry. Magnetic resonance imaging of the brain demonstrates multiple hyperintense lesions in the periventricular white matter and corpus callosum. A lumbar puncture is performed and cerebrospinal fluid analysis reveals oligochronal bands. Histopathological examination of brain tissue obtained from biopsy shows demyelination, perivascular lymphocytic infiltration, and gliosis. Which of the following pathological changes is most characteristic of multiple sclerosis in this patient? Neuronal loss and neurofibrillary tangles, amyloid plaques and neurogenic plaques, gliosis and perivascular lymphocytic infiltration, neurofibrillary triangles and Lewy bodies, neurofibrillary triangles, and beta-amyloid deposition. So, gliosis and perivascular lymphocytic infiltration. MS is a chronic inflammatory demyelinating disorder of the central nervous system, which is characterized by the presence of multiple focal lesions in the brain and spinal cord, lesions in time and space. The pathological hallmark of MS is the presence of demyelinated plaques, which are areas of inflammation, demyelination, gliosis, and axonal loss. Gliosis refers to the proliferation of astrocytes, which form glial scars in response to CNS injury. Perivascular lymphocytic infiltration, primarily involving T cell, is a characteristic feature of MS lesion and is thought to contribute to the inflammatory process and demyelination. Let's move to another question. So, which of the following pathological changes is most characteristic of amyotrophic lateral sclerosis in this patient? 50-year-old man presents to his neurologist with complaints of progressive weakness in his arms and legs. Along with muscle twitching and difficulty with fine motor tasks, he reports a history of intermittent symptoms over the past year, including muscle cramps and fasciculations. Physical examination reveals muscle atrophy, brisk reflexes, and spasticity in the upper and lower extremities. Electromyography demonstrates denervation of the fibrillation potential in multiple muscle groups. Magnetic resonance imaging of the cervical and lumbar spine shows no evidence of compressive lesions. Histopathological examination of spinal cord tissue obtained from biopsy reveals loss of motor neurons in anterior horns and gliosis. Which of the following pathological changes is most characteristic of amyotrophic lateral sclerosis in this patient? Beta-amyloid plaques and neurofibrillary tangles, Lewy bodies and alpha-synuclein deposition, loss of motor neurons and gliosis in the anterior horns, perivascular lymphocytic infiltration and demyelination, vascular amyloid deposition, and microhemorrhages. So the correct answer is C, that is loss of motor neurons and gliosis in the anterior horn. Amyotrophic lateral sclerosis, also known as Lou Gehrig disease, is a progressive neurodegenerative disorder characterized by the degeneration of upper and lower motor neurons in the motor cortex, brainstem, and spinal cord. The pathological hallmark of ALS is the loss of motor neurons in the anterior horns of the spinal cord, leading to muscle weakness, atrophy, and spasticity. Gliosis, characterized by the proliferation of astrocytes in microglia, is often observed in affected areas of the spinal cord, and these pathological changes result in denervation of muscles and subsequent muscle wasting and weakness. Beta-amyloid plaques and neurofibrillary tangles are characteristic feature of Alzheimer's disease. So, when I talk about Alzheimer's disease now, so which of the following pathological changes is the characteristic of Alzheimer's disease in this patient? A 75-year-old woman presents to her primary care physician with complaints of memory loss, confusion, and difficulty performing daily tasks. Her family members report a gradual decline in her cognitive function over the past few years. Physical examination reveals impairment in recent memory and executive function. Lab investigations are unremarkable. Magnetic resonance imaging of the brain shows cortical atrophy, particularly involving the temporal and parietal lobes. A positron emission tomography scan demonstrates decreased glucose metabolism in these regions. Histopathological examination of the brain tissue obtained postmortem reveals beta amyloid regions and neurofibrillary tangles. Now, which of the following pathological change is most characteristic of Alzheimer's disease in this patient? Gliosis and loss of motor neurons in the spinal cord, neurotic plaques and granulovacular degeneration in the cerebral cortex, Lewy bodies and alpha-synuclein deposition in the substantia nigra, perivascular lymphocytic infiltration and demyelination in the white matter, gliosis and loss of Purkinje cells in the cerebellum, neuritic plaques and granulovacular degeneration in the cerebral cortex. Alzheimer's disease is the most common cause of dementia in the elderly. The pathological hallmark include the presence of beta-amyloid plaques and neurofibrillary tangles in the brain. Beta-amyloid plaques are extracellular deposits of amyloid beta peptide derived from the cleavage of amyloid precursor protein, which accumulate in the cerebral cortex and disrupt the neuronal function. Neurofibrillary tangles are intracellular aggregates of hyperphosphorylated tau protein, which form twisted fibers within the neurons and lead to neuronal dysfunction and cell death. Now, neuritic plaques are also known as the senile or amyloid plaques, consist of beta-amyloid deposits surrounded by dystrophic neurites, astrocytes, and microglia. And the granulovacular degeneration is characterized by the presence of intraneural vacuoles containing granules, which are thought to represent abnormal protein aggregates. Now, the last question before we finish this. Which of the following pathological changes is most characteristic of Parkinson's disease in this patient? Now, let's see how the Parkinson's disease patient will present to you. A 65-year-old man presents to his neurologist with complaints of resting tremor, bradykinesia, and rigidity. He reports a gradual onset of symptoms over the past few years, along with difficulty with balance and coordination. Physical examination reveals a resting tremor, cogwheel rigidity, and suffering gait. There is also a masked facies and reduced arm swing while walking. MRI of the brain shows no significant abnormalities. A positron emission tomography scan demonstrates decreased dopamine activity in the basal ganglia. Histopathological examination of the brain tissue obtained post-mortem reveals the presence of intracellular protein aggregates known as Lewy bodies, predominantly in the substantia nigra. So, which of the following pathological changes is most characteristic of Parkinson's disease in this patient? Beta-amyloid plaques and neurofibrillary tangles in the hippocampus, Lewy bodies and alpha-synuclein deposition in the substantia nigra, gliosis and loss of motor neurons in the spinal cord, perivascular lymphocytic infiltration and demyelination in the white matter, granulovacular degeneration and peak bodies in the cerebral cortex. So Lewy bodies and alpha-synuclein deposition in the substantia nigra. The pathological hallmark of PD is the loss of dopaminergic neurons in the substantia nigra, pars compacta, and the presence of intracellular protein aggregates known as Lewy bodies. Lewy bodies are composed primarily of alpha-synuclein protein and are thought to contribute to neuronal dysfunction and cell death in Parkinson's disease. Now, all of the topics discussed here are in detail discussed in significant or in uh, those specific neurology modules. You can go and watch those videos. Thank you for watching. Keep studying.